Hello, I'm Paddy Stone. I'm the head of the Marie Curie Palliative Care Research Department here at UCL. Making a prediction about how long someone has left to live is known as making a prognosis. And people with advanced incurable cancer, their families and friends and the doctors and nurses looking after them often wish to have a greater understanding about how long those patients may have left to live. This information is important for patients because people in this situation often explain that they want to have as much time as possible to make preparations for the ends of their lives. And having greater understanding about how long they may have left to live can give them that time to make those preparations. It's important for family and for friends because these are the people on whom the greatest burden of responsibility is going to fall for caring for patients with advanced diseases. And finally, it's important for doctors and nurses because it can help with the planning of services and it can help smooth access to certain benefits for patients. For instance, access to NHS continuing care funding for people who wish to be cared for at home at the ends of their lives, or indeed smoothing the transition into a hospice if a hospice bed is required for people at the ends of their lives. Traditionally, prognoses are made by expert doctors and nurses using their medical knowledge, skills and experience and clinical intuition to make their best prediction about how long a patient might have left to live. And we've got plenty of research going on in the department at the moment looking at how doctors and nurses make those prognostic decisions and trying to understand how to teach more junior doctors and nurses to get better at making those decisions. And we've also got research looking at how we can communicate that information more clearly to patients and their families. However, there is another approach, and that is to collect as much information as possible about a patient's condition and then to follow the patients up to find out whether they live or die and within what time scale, and to combine all of this information using a computer to create what's called a prognostic model or a computer model to predict when patients will die. This is very similar to the approach that weather forecasters, for instance, use when they make predictions about what the weather is going to be like tomorrow, next week, or sometimes even next month, based on the data that they've collected over the previous few days about what the weather is currently like. So we have in fact already done such a study where we collected data on over 1,000 patients with advanced cancer, and we followed them up for several months to find out which patients died when, and we looked at all of the data and we created a computer model to predict which patients or how long patients would survive. And what we found in that first study was that our predictive model, which we called the PIPS model, the Prognosis in Palliative Care Study model, was at least as good as the best doctors and nurses when they put their heads together and came up with a prediction, and it was significantly better than a clinician acting alone. However, before we could conclude that our prognostic model was better than other prognostic models or better than the clinical judgment of doctors and nurses, we had to do another study where we took another group of patients and we studied them going forwards over a period of a few years to find out whether our predictive model actually worked in practice. And that's what the PIPS-2 study has been all about. And after 2 years, we've now finished collecting data on over 1,800 patients with advanced incurable cancer at 28 sites, that's hospices, hospital palliative care teams, community palliative care services, across England and Wales. And we're now at the exciting time in our research where we're analysing these results. And I hope to be able to announce whether or not the PIPS prognostic models are indeed actually better than other models or better than the best doctors and nurses later this year in 2019. That won't quite be the end of our research in this area though. We will still need to, even once we've decided which is the best way to predict survival in patients with advanced cancer, we still need to find out whether routine introduction of this prognostic method into clinical practice will actually result in better care for patients and a better experience of care by patients and their relatives. And finally, whether it will result in easier access to specialist palliative care services and benefits. And that will be our research going forward over the next few years.